But we have our Dr. Caesar Ursic. Did I say that correct, Doctor?
That's close enough.
Close
Shane.
enough.
Yeah.
I know. I let people slide with my last name too every once in a while. But he's live here in the studio, which is a first when we talk with our Ohana from Maui Health. Good morning, Doctor.
Good morning, Shane. Thanks for having me on.
How was your Christmas?
Christmas is fantastic.
Awesome.
Yeah.
Spent with family?
My daughter is here from the mainland.
Nice.
I know she's listening, and we're having a great time.
All right. Okay, Doctor, so what kind of trauma? So Dr. Caesar is Maui Memorial Medical Center's trauma medical director and general surgeon, okay? So, Doctor, what kind of trauma-related injuries do we see most over the holidays?
Well, over the holidays, it's pretty much the same as the rest of the year, except there are a few extras, and I would say the fireworks. We love the fireworks. I don't know. Are the big ones illegal?
No, it's illegal.
Everything's...
Well, what you buy from the store is legal.
Those are legal, but
Yeah.
we have those beautiful aerials
Big ones.
and bombs that go off. And I'll tell you, Shane, every year we see 2 or 3 very unfortunate victims of explosions. And sometimes it's just a loss of finger or a hand, but sometimes it's loss of life because these are powerful explosives. So I would say be careful, know what you're doing. Alcohol and fireworks don't mix.
Yeah, they don't.
And even the legal ones that you can buy for the kids, they can get very hot and can produce severe burns. So you want to stay out of the emergency room. We don't want to see it in the ER. Be careful with these things. They're very hot. Adults supervision, very important.
Very important for the kids.
For the kids. The rest of the holidays, unfortunately, it's alcohol related. We have a lot of alcohol related injuries and deaths. Driving in a car. It's okay to celebrate, but we have to be responsible. And I think it's easy to say, but difficult to do. But a designated driver is important because once we start drinking, I know it's never happened to you, but we or me either, but we kind of change a little bit when we drink and we stop thinking about the common sense things. So
especially if you're in that celebratory mode.
Exactly. And who isn't, right? At the end of the year and the holidays. So drinking and driving. And I want to give a shout out to our colleagues with the Maui Police Department because I've been driving around and I've seen a lot of sobriety checks, which I think is fantastic. They're out there with the cars and the blue lights and stopping people and just making sure that they're safe. And not only the drivers, but also the other people on the road that are safe from the drunk driver.
Big aloha out to MPD.
Absolutely.
Doctor, speaking of our visitors, like our local people, our residents here on the island, they listen to our radio station, especially on the Thursday mornings, but maybe our visitors. Speaking of our visitors, what safety advice do you have for our visitors to our islands?
Well, I would say the safety advice is don't take the beautiful scenery and the aloha spirit lightly because there's a lot of danger out there, specifically the ocean. So Hawaii, as we know, we're sitting in the middle of a very deep ocean. It's not like on the mainland where you have a gradual beach coming in. The waves here can be treacherous, as you know. And again, we have every year, and it's more during the holidays because the tourists are not as experienced. We have people who ride the waves on a boogie board or body surf, and they underestimate. They wind up in the emergency room with a spinal cord injury, paralyzed.
Wow.
And once you're paralyzed, you're paralyzed.
Yes.
There's no coming back.
We just got a high surf warning this morning.
I heard it.
And during this time is when the really big waves come to our island. So please be aware, our visitors.
And, have you been up to Black Rock Beach and done any jumping off that rock? You don't have to admit it, but I know. I've been up there, and I was there with my daughter the other day, and I'm not going to say it happened, and maybe it happened, maybe it didn't, but I really wanted to jump off that rock. And it's tricky. It's tricky. And we get...
Just getting out to the jump point is tricky.
Swimming out there or scrambling over those rocks. And again, we see a lot of tourists who come and do that, and all the other amazing places that we have to jump into the water, and they can pay the price with severe injuries. So look before, think before you jump. And what is it that they say? When in doubt, don't go out. Yeah.
If unsure, ask somebody.
Ask the locals.
Awesome. That's good advice. Doctor, what about kitchen-related injuries? With everyone busy cooking during the holidays, do you see a lot of that in the ER too?
Well, we see a handful of kitchen-related injuries involving hot surfaces, fires, flames, scalding water. So some of the common tips are when you've got the pots and pans on the stove, make sure the handles are tucked away inside. And not sticking out, because it just takes a little turn and you're there. The sharp instruments, I'm used to using the sharpest instruments in the world, the scalpels, but the sharper they are, the safer they are, because you don't have to push so hard. And it's when you push that you can sometimes miss, and off comes a fingertip.
These are things that we learned in school, right, Dr. Caesar? But we need to be reminded too, because it can be in the back of our memory, somewhere behind.
And we get distracted, and everybody's happy, and you're making great food, and so the kitchen, and also make sure you can say where your fire extinguisher is. We should all have a fire extinguisher somewhere close by, so that you can use, because you don't want to throw water on a grease fire. You make it a lot worse.
Awesome. Well, some very great tips this morning. Want to keep all of our people safe. Anything you want to add, Doctor, before we wrap things up here?
Let me give your listeners out there 3 words of advice, 3 rules that I would say will keep you out of the emergency room and having me come over to talk to you and talk to your family, which I don't want to do.
Yes.
And that's number 1. Pay attention.
Pay attention.
Number 2, slow down.
Slow your roll.
And, a yellow light is not go fast. A yellow light means slow down, get ready to stop.
Yes.
And number 3 is be patient. You're going to get there eventually. A 1 minute delay is not a big deal.
This is an island.
Right? Where are we going to go?
Dr. Caesar, I want to wish you and your ohana a happy holiday season and a happy new year. Thanks for coming by this morning.
Thank you, Shane. I'm a big fan. It's a privilege.
Thank you, my man. My friends, my ohana over there from Maui Health, always with the good wisdom and keeping us safe and healthy, especially during this time of year.